Bless you. My goodness, it is that time of year. Allergy season's here, but it doesn't just plague us. Our pets suffer from allergies too. Is it seasonal or is it something else? IndyVet's Dr. James Speiser, our buddy, is here with things to look for in your pets and, more importantly, I guess, ways to help. So we think of this as being something we deal with, but pets deal with it too. We talk a lot about food allergies for pets, but there are things that they breathe in that are harmful.
You know what? There's really 4 different categories of allergies we see in pets, and all of them manifest in the skin. We don't have so much of the oral nasal problem like people. It's the skin. So we really have inhalant allergies where they inhale pollens, molds, dust, and so forth, just like we do, but it manifests on the skin. Then we have contact allergy, kind of like poison ivy in people, where chemicals, irritants contact the skin. We have flea bite allergy, intense allergy to flea saliva. And then, of course, we have the food allergies that we were talking about just moments ago. Really, in the cat, the primary problems are beef, dairy, and fish, whereas in dogs, it's beef, dairy, egg, wheat, soy, and chicken, believe it or not. And actually, I brought some photos here of, here's a cat that actually is demonstrating food allergy. This is a classic. Cats just scratch their head to pieces with food allergy, and it's commonly mistaken for like a problem with their ears or mange and so forth. The next slide we have, if it comes up here, is, well, we have flea bite. There's a classic flea bite allergy in a dog where they have hair loss and a redness and scabs on the tail head. The next one, I think, is going to be a little Westie that actually has inhalant allergies. Look at that. It's lost all its hair, it's red, it's itching all the time. That's horrible. And the next slide we have would be similar for a contact allergy where their feet get very red. This also, however, could be an inhalant allergy as well.
Well, those are pretty severe cases where it is obvious that they are suffering. Some of the other symptoms might be less detectable. So what are we looking for there? And then what do we do to help them out?
Well, certainly with food allergies, we can also have difficulty with vomiting and diarrhea as well. But for the most part, all of the other allergies that we were talking about manifest with the skin problem.
Okay, so what are the ways that, I mean, obviously it's sometimes tough if we're just talking about the food allergies to isolate what it is, because they get treats, they get, you know, the food, other things that they get a hold of. How do you know what it is? There
is testing that can be done to identify which foods the animal might be sensitive to. Clearly for food allergy, for flea bite allergy, and also contact allergy, the treatment fundamentally is eliminating the fundamental cause, what they're getting into. When it comes to inhalant allergies, we certainly antihistamines can be helpful in mild cases. Corticosteroids can be used for short courses. There's a wonderful drug called Apoquel that we're using a lot in dogs now that's wonderful for allergies. And then, of course, you can have your dog or cat allergy tested by a veterinary dermatologist, identify specifically what it is that they are allergic to, so that then they can be desensitized.
Okay, things to watch for. If you have questions, reach out to the pros. So we appreciate that. Dr. Speiser with IndyVet, Emergency and Specialty Hospital. If you'd like a list of their services and educational opportunities, we've got a link for you made real easy at fox59.com. Rosie, she doesn't have any allergies. Does she have any allergies?
No, she doesn't.
Because I know sometimes with the shorter snouts, they sometimes do. So, Rosie, we're glad that you are good to go. All right.